Welcome to another short from the Vet Med Digest. Today we are focusing on the complex and serious intestinal condition known as lymphangiectasia in dogs, a common cause of the life-threatening syndrome called protein-losing enteropathy. Intestinal lymphangiectasia involves the pathological dilation and rupture of lymphatic vessels, or lacteals, within the small intestine, leading to the loss of protein-rich lymph fluid into the bowel lumen. This fluid loss results in severe hypoalbuminemia, hypoglobulinemia, and hypocholesterolemia, often leading to complications like ascites, edema, and a high risk of thromboembolism. Historically, over half of dogs with protein-losing enteropathy die from the disease or its complications. Intestinal lymphangiectasia is frequently associated with chronic inflammatory enteropathy, and while some inflammation may be immune-driven, the leaking lymph itself can also cause local inflammation. Crucially, immune suppression is generally avoided in human intestinal lymphangiectasia due to a lack of evidence for an autoimmune cause and the risk of exacerbating pre-existing immune deficits in people with protein-losing enteropathy. In contrast, immunosuppressive drugs are commonly used in dogs, though studies suggest dogs treated with diet alone may have significantly better outcomes than those treated with immunosuppression. The cornerstone of management for intestinal lymphangiectasia is dietary modification, specifically fat restriction. Reducing dietary fat limits chylomicron production, which in turn reduces lymphatic pressure and flow, minimizing leakage. Diets containing less than 20% fat on a metabolizable energy basis are considered suitably low, with ultra-low-fat diets being even more restrictive. Highly customized, home-prepared low-fat diets, formulated by a veterinary nutritionist, are often ideal for achieving the necessary restriction and ensuring nutritional balance, especially for essential fatty acids and fat-soluble vitamins. Diagnosis is confirmed by intestinal biopsy showing dilated lacteals. Non-invasive diagnostic tools include ultrasound, which can show characteristic hyperechoic mucosal striations, and the novel technique of strain elastography. A recent case report demonstrated that increased intestinal hardness rates measured by strain elastography returned to normal after successful treatment, suggesting its potential as a monitoring tool. For refractory cases, the drug octreotide is being investigated. A retrospective study noted that octreotide, a somatostatin analog, appeared to lead to clinical improvement in 50% of dogs with protein-losing enteropathy/intestinal lymphangiectasia refractory to standard therapies, and was generally well tolerated. Ultimately, the management of this serious condition requires a careful, individualized approach, prioritizing evidence-based dietary changes and cautious use of medications. Thank you for listening. The link for the full podcast is below. Remember to like, share, and subscribe if you enjoy this kind of material. From Vet Med Digest, where we keep minds inspired, hearts light, and tails wagging,